Evidence-based nursing. So what is it? Evidence-based nursing is the integration of best research evidence with clinical expertise and patient values to achieve optimal clinical outcomes. So there are steps to this. So asking a question, searching for the best evidence, interpreting the evidence, using your expertise and experience, and talking with your patient about options, and then evaluating. And why is it important? Why should we care? It leads to highest quality care and patient outcomes, and it reduces healthcare costs, reduces geographic variations in the delivery of care, increases healthcare provider empowerment and role satisfaction, and it reduces healthcare provider turnover rate.
So evidence-based nursing is based off of research, but it's important to remember that not all research has the same credibility. Our base level of credibility is original research, which is our experiments and studies. Then our mid-level of credibility is our systematic reviews and meta-analysis, which is basically when a researcher takes all the original research and compiles it and makes it basically like a scholarly essay. And our highest level of research is clinical decision support, which basically means when nurses and doctors take what was found in those papers and puts them into practice to actually see what's being done. There's a bunch of different examples of evidence-based nursing, which we'll get to later. But the basic nursing care, and why evidence-based nursing is important, is it allows for modern research to be able to be integrated with practice and tried principles. It allows for healthcare to have the most up-to-date care for these patients and be able to allow for the healthcare system to be a living and breathing system that is always evolving and continuing.
Hi guys, my name is Jonah Hendricks. I'm here to talk to you guys a bit about diabetes, cardiovascular care, and cancer, and evidence-based nursing. It's very important to have more knowledge about diabetes so we can treat it a bit better, and we can also improve patient care through increasing physician access to the latest information so they can get the latest care about the diabetes. With cardiovascular care, we've got to ask them certain questions. Are you feeling right? Is your chest tight? Does it hurt to breathe? It's very important to get a lot of including data from men as appropriate for recommendations for diverse populations of women, because women are more susceptible to this, and the more information we have, the better we're going to be. And the last one is cancer care. Cancer care, especially with breast cancer right now, it's very susceptible in a lot of women, and this will help them with any side effects, any anxiety, depression, and the more information we know, the better we can care for them.
Hey guys, my name is Matthew Rollison. So I was in charge of maternal child care and neurologic care. So essentially I found out that breastfeeding is a better analgesic treatment, or helping with pain tolerance for things like baby surgeries like venipuncture, heel lancing, intramuscular injections, than being swaddled or held or pacified essentially. And that's what they do now, just because they found better research for it, and it has reported lower heart rates, and it's just a better way to help babies cope with pain. And for neurologic care, they did some test families, for dementia patients. The carers of the patients often have high stress, so they wanted to see what they could do to help. And they did test families, and they did find that it did help lower grief in some ways, but there just wasn't a guarantee for it, so they kind of ended up with, saying that it's cool, good thing to do, but it won't be required, and we don't guarantee it'll help.